So if there's a patient of hypothyroid and you start thyroxine, and after 6 weeks, the patient will come up and will say, "Oh, Dr. Saab, I'm so good now." That gives you so much happiness. A patient who has thyroiditis and you have treated him or her, and she comes back and say, "Oh my goodness, I feel so better now." So ये जो जुमला है ना, I feel so better, that really makes you happy. Then there is issues of infertility, and ये बहुत छोटी छोटी चीजें हैं. थोड़ा सा थायराइड खराब है, infertility हुए चली जा रही है, and you treat that infertility, and after a few months they have a baby, and then they are sending you pictures of that baby. Doctor साहब आपकी. So that's the happy part of it. It really makes me so happy, and I'm so happy that I finally did this field.
Hi everyone, welcome to another episode of Women with Steps, where we bring you remarkable stories of women in healthcare. Our guest today is a name well known in the medical community. She is an inspiration in the field of medicine, serving as an Associate Professor of Endocrinology at JPMC Karachi. We are honored to welcome you, Dr. Urooj Lal Rehman.
Assalamu alaikum. How are you, Afreen?
I'm great. How are you doing?
I'm good. I'm very thankful to you and your colleagues from Women with Sets, for having me here, and thank you.
It's an honor to have you. It's an honor for us to have you on the show.
Thank you so much. Ji.
Dr. Urooj, my first question to you is going to be, how was your early life like?
So, early life meaning bachpan, the childhood. So it has been. It was a good childhood. I had opportunity to be exposed to so many people who were had different interests and everything. I had so many strong female role models around me. My grandmother was a subdivisional educational officer at Kohat, KPK. My mother was working at a Pakistan Academy of Letters, so which dealt with all these writers and poets, and so we had this opportunity of meeting people, educated people, and everything. So that's what which inspired me, to study and to work hard. I had people in my family who were doctors, and I could see them, their success and their work. It also was always inspiring. There were times, so not everyone is born into upper class. So most of us are from middle class, and you see around you people, and you realize by looking at them that the thing which matters the most is success. But when you are successful, people, their attitudes, their ways, the changes towards you, and that is what was one of the things, driving things. I saw people who were educated at some point in life. There was something. So the attitudes of, you look at others and you realize कि क्या होता है, कैसे होता है, कैसे लोगों के रवैयों में. That was one point which was inspirational. Besides, I was lucky to have educated have people who were working and padhe likhe and everything. I was lucky to have that. Had loads of books around in my house, had the chance of reading as much as I could. That was my passion, hobby of reading and everything.
My second question, Dr. Urooj, would be, what drew you to this particular specialty, endocrinology, and what specifically do you like about this field?
So, I really liked endocrinology from the very beginning. When I was in my first year MBBS, I still remember. It's so, um, at that time, you really don't know what you want to do with your life. You're just trying to go through MBBS, and first year and second years are first year especially becomes very difficult, because it's completely, you don't even understand what they're teaching you in the beginning. So, and I remember during my first prof, I remember going through the upper limb and the lower limb and the feline, and then doing the physiology, different units are coming up, cardiology, pulmonology, and then there was endocrine, and they taught us thyroid and then the pituitary, and it was so fascinating. These little hormones somewhere in the body are running around, doing their work, and a master gland up there working. And I remember during my first prof, what happened was that there was an external. What she was doing was she was asking questions based on our interests. So she asked me कि अच्छा बताओ तुम्हें कौन सा topic बहुत अच्छा लगा है? And I just said endocrine. And she like, you really like endocrinology? And I was like, जी मुझे अच्छा लगा है because I understand it really well. I do understand the negative feedback and जो physiology में उस वक्त उन्होंने पढ़ाया हुआ था. Or then she started asking me about thyroid in children and the cretinism, and somehow I knew it. And I passed my exam. That was the first time when I said that I would like to do endo. And at that point, he had said to me this one thing, there are not many specialized endocrinologists available, and the field is not that much established. That was like way back in 1999, I think, when I was doing my second year. So then I did my training, and during training, I had medicine training. I did it from Pakistan Institute of Medical Sciences, Islamabad. And I was lucky to have Professor Rauf Niazi as my mentor. And he had interest in endo. So he used to talk and the pheochromocytomas and all these stuff, this complex molecules and hormones and the complexity, and it really intrigued me. So at the time of intermediate, I wanted to shift my field and I wanted to go towards neurology because वो भी मुझे बड़ी अच्छी लगती थी. 1+1 is 2, 2+2 is 4. There's nothing else in between. Medicine is too vast. So for one thing, you have so many differentials, and it really gets mind-boggling when you're doing it. And I talked to him, and he was like, "You really know your endo. You can do that. So why don't you?" And I was like, "Yeah, I can do that. So let's do it, na." Or the beauty of endocrinology is that the diagnosis is not that difficult. You can make the diagnosis acromegaly. You see the patient, and you can. The beauty is the treatment part, and the beauty is the how patient responds. So if there's a patient of hypothyroid and you start thyroxine, and after 6 weeks the patient will come up and will say, "Oh, Dr. Saab, I'm so good now." That gives you so much happiness. A patient who has thyroiditis and you have treated him or her, and she comes back and say, "Oh my goodness, I feel so better now." So ये जो जुमला है ना, I feel so better, that really makes you happy. Then there is issues of infertility, and ये बहुत छोटी छोटी चीजें हैं. थोड़ा सा thyroid खराब है, infertility हुए चली जा रही है, and you treat that infertility, and after a few months they have a baby, and then they are sending you pictures of that baby. Doctor साहब आपकी. So that's the happy part of it. It really makes me so happy, and I'm so happy that I finally did this field. And it makes another thing, the pictures and everything, that they're sending their pictures of their babies and everything, that gives you a feeling of a big family. You make new family friends, and you meet people, and that these people are going through, there's you know their journey, you're being part of that journey. It is a lot of satisfaction. So as I said in the beginning, that my childhood, I learned that success is very important. I also learned that not only success, but if people are happy around you are happy, it makes you happy. And that's the medical field is a field which can give you that opportunity. So a person who is down because of his health, or because of these issues of weight or PCOS or fertility, and you help them out and you see a positive change in their lives, it really, really brightens the day, and it really is a very happy moment for us. So that, yeah.
Oh, yeah, that's really nice to hear. Dr. Urooj, my question to you is, since endocrinology is a subspecialty of internal medicine, which other subspecialties of internal medicine are seeing the growth in Pakistan right now, currently?
So the infectious diseases is one. So if you are into going into a little, infectious diseases is a little, chaotic because patient can go into septic shock and you can, but still infectious diseases is one which you can go into. Rheumatology is really good. It's 9 to 5. Voila, have emergencies as well because acute patients with acute episodes and can come to you. But again, it's not that hectic. Endocrinology is not that hectic. So those who don't want to do a very hectic kind of schedule, it's good for them. Emergency medicine is a real good field as well. It has a lot of space as well. But for that, you should be an adrenaline junkie, ready to jump and ready to work 24 hours a day. क्योंकि आपको रात को भी जाना पड़ता है as a consultant, you have to go, and in the morning you have to go. So rounds और ये वो, और उसमें आपको बहुत quick करना पड़ता है. So it's a really tiring field, emergency. It's really demanding field, but the
Yeah,
field
demand.
has good growth because लोग कम हैं. And obviously reason यही है कि it's too demanding. जो आपकी और है मतलब gastroenterology, and they are also good, but I think थोड़ी सी इनमें अब ज्यादा हो गए हैं लोग. कार्डियोलॉजी जैसे बहुत ज्यादा, there are a lot of people over there, it's now packed. But from surgical side, I would say vascular surgery is really good. But again, vascular surgery, you really need to be on your toes, and you really need to be, it's a very hectic field. For girls, breast surgery is really good. And जो genitourinary tract और उसके जो होते हैं, that's really good. So yeah, super specialties in medicines are really good. Ophthalmology is another good option if you want to go in. It has a little bit of surgery and most of the medicine in it. So ophthalmology is also good. I think any field in which you have interest, that is the main thing. आपका interest होना
That,
चाहिए. So if you have interest, it's one of the best fields. So
this was really great info for all the new grads out there. Thank you.
mm.
Dr. Urooj, my question, as an associate professor in Pakistan and being a woman, did you face any challenges? And if there were, how did you navigate them?
So yeah, challenges are everywhere. Being a woman, of course, it's a large field, and it's man's field. It's changing with time. It has changed a lot. Thank goodness. In our time, we have more females, and the field is completely, gender roles are completely changing over here. I was fortunate enough that I had worked with most of the females. My and PIMS, the boss, my supervisor, was Professor of Nazi, but the boss, the head of department, was a female, Professor Nigat Bilal. Here, when I came to Karachi, the boss was Dr. Tasneem Hassan, Professor Tasneem Hassan. And now at the moment, we all are women in our ward. We have only few men in our ward. So I, fortunately, Alhamdulillah, I didn't have to face a lot of harassment or a lot of things. But yes, there is competition, and this competition is not only between men and women, there is a competition between women and women as well. Your colleagues, they will compete with you. Your besties might compete with you. This is the real fact. आप जब आपको, लेकिन उसको आपने deal, you have to deal it in a way that no one is hurt. And you take it, if you are successful, you take it with a crown that yes, I am. But in that process, you stay humble. And सबसे important is that you keep on working. आप अपना काम करते जाएं. So whoever is trying to pull your leg, whoever is trying to create problems will not be successful. If you are working and you're working right, and if you are working and you're not doing any wrong or any harm to anyone, so you keep on working and you will be rewarded. And the reward is in form of it can be in the form of patients coming up saying thank you. It can be in the form of juniors coming up and saying thank you. It can be in the form of promotions or appointments or people acknowledging you, just like I'm sitting here. That's a reward. So things happen. And बहन भाई भी तो आपस में करते हैं ना. So just imagine it like that and ignore and keep on working hard. That's what you need to do. Just concentrate on what you are doing. Focus on your targets. And that's the important thing.
Which one area of women's health do you think is often ignored or overlooked in our society?
One thing which is
From endocrine.
commonly, which is ignored or which is not talked about much because of being taboos associated with it. One is puberty. So adolescence jo hoti hai, we don't talk much about it. Mothers don't talk much about it. Girls, they find about their puberty, the menarche periods from their cousins, from their friends. There is a taboo around it. We're not allowed to talk about it in front of family members. If someone is having, they will try to hide the whole thing. And it is sometimes it is really a shock for girls when they start their periods. They really get scared because something it just happens and they bleed and they think that they will die of bleeding. I know kids who have gone through that trauma. So this need to be talked. This need to be discussed. There should be discussions around this in the home, mothers talking to their daughters, even boys. Fathers need to talk to their sons because when they go through puberty, they have things and they need to be discussed. It should be talked in schools because hygiene is very important and these girls need to know about the hygiene, that practices what they need to do. One is this, and number two is the PCOS, again related to these periods. So if there is any change in this period, if there is some irregularity with it, if they are not coming, or if they are coming frequently, or they are excessive, or there is hair growth, please, these girls, they need to talk, and that they will come to know if they are given that confidence to talk. अगर इसके साथ हम टैबू लगा के बैठे रहेंगे तो लड़कियां बताएंगी भी नहीं. There are girls who won't come up and tell their parents, mothers, कि भाई इतने दिनों से उनको पीरियड नहीं आए या उनके पीरियड्स बार बार आ रहे हैं, because they will be scared. So I know a girl who didn't even know that there should be pubic hairs and hairs in her armpits. She was worried, what is this happening to me? When this started. So these are the things which need to be talked. Okay, fine, not very openly, लेकिन घरों के अंदर mothers, they need to talk to their daughters, and daughters should have that confidence that when they talk to their mothers, they will not be डांट नहीं पड़ेगी या ये नहीं कह दिया जाएगा ये कैसी बातें कर रही हो किसने कह दिया ये चीज. And we need to understand that PCOS is not just irregular periods or hirsutism. It can lead to long-term problems. It can lead to infertility. It can lead to diabetes. It can lead to GDMs. It can lead to so there are so many things related to it. And the weight, the eating habits, they all need to be looked into. So this is part of the women health which has to be talked about. Women health sexual health is another health which needs to be talked about, which we do not do much because we think that हमें इस पे बात करनी ही नहीं है या ज़रूरी नहीं है. That's also very important कि what sexual health is and how to keep yourself healthy for that. It's very important. And these are overlooked problems and overlooked everywhere. So I would like.
think you have highlighted some very important ones here. That, Doctor, what's one lesson medicine has taught you, or working in medicine has taught you? Any personal lesson or professional lesson?
So personal lesson is humility, be kind. I've learned to be empathetic. I heard about this word in medical field. I did not know much about empathy. I knew about sympathy, but I never knew about empathy. And now with time, I know what empathy is and how to be empathetic. That makes you really humble when you feel what other person is exactly going through, when you can understand that. And I have learned it from my profession. This medicine has made me realize. And number two, keep on working hard. Do not look around. Do not be scared of other people. Do not be disheartened or lose hope. Failures should not drag you down. They happen in this field where failures will happen, and we should not feel down कि भाई क्यों हो गया इस दफा, अभी नहीं हुआ तो नेक्स्ट टाइम हो जाएगा, नेक्स्ट टाइम नहीं हुआ तो नेक्स्ट टाइम हो जाएगा. कोई भी आपसे ये नहीं पूछता कि आपने एमबीबीएस में कितनी सप्ली लगाई, आपने कितने पेपर्स रिपीट किए, आपने गोल्ड में, हाँ ठीक है आप गोल्ड मेडल लेते हैं, आप अपने पेपर पे लिख देते हैं, लेकिन किसी को इससे फर्क नहीं पड़ता है. अगर आप अच्छे डॉक्टर, इफ यू आर अ गुड डॉक्टर, इफ यू आर अ हीलिंग डॉक्टर, इफ यू आर अ लिसनिंग डॉक्टर, देन पीपल डोंट केयर कि आपका गोल्ड मेडल था या नहीं था. ठीक है. एंड इफ यू आर एम्पथेटिक, सो ये जो आपकी फील्ड में जो आप थोड़ा सा नीचे जाते हैं, और एवरीवन गोज डाउन. आई नो पीपल हु हैव बीन toppers during MBBS were not able to clear part ones in the first attempt, but then there were people who failed all of their profs wouldn't clear them in the first attempt, who cleared their part ones in first attempt. This is वो आप इसको इस फेल और पास होने से आप इसकी वो नहीं कर सकते हैं कि ये जो है ज्यादा इंटेलिजेंट है या नहीं है. इट्स ऑल अबाउट टाइमिंग, उस वक्त आपका क्या था, आप किस, it is all about that day actually, okay? Because everyone struggles, everyone works hard, everyone learns, everyone tries to remember everything. ऐसे कोई भी इम्तिहान में नहीं आता कि पढ़ के ना आता हो या वो ना करता हो. So these are some things which will happen, and they happen with everyone, and we should not take them to heart, but we should take them as a step और आगे हिम्मत करके बढ़ना है. दूसरी चीज, especially for the girls, let me tell you, your two things are important in your life. क्योंकि लड़कों के लिए इतना प्रॉब्लम नहीं है, ठीक है. लड़कों को फैमिली लाइफ के लिए इतना कुछ करना नहीं पड़ता, क्योंकि उनके ऊपर फोकस सारों का यही होता है कि इन्होंने आगे जाके घर संभालना नहीं होता, लड़कियों ने घर संभालना होता. So there are two things, career and your profession, career and your family. These are two things which will be with you throughout your life. अच्छा, आप करियर को चूज करते हैं और फैमिली को बाद में करते हैं. जैसे एमबीबीएस के बाद हाफ ऑफ द क्लास गेट्स मैरिड, हाफ ऑफ द क्लास गोज टूवर्ड्स देयर करियर. लड़कियों की बात करें, बहुत सारी छोड़ भी देती हैं. लेकिन मैं ये कहती हूँ कि आप चाहे करियर पहले लो, आप चाहे शादी पहले करो, बच्चे करो, और फिर उसके बाद करियर करो. जिसने करियर पहले लिया है, मैंने करियर पहले लिया, मैं बाद में बेबीज की फैमिली की, और वो मेरे बच्चे अभी बहुत छोटे हैं माशाल्लाह से, एक 10 साल का, एक 4 साल की है, और मैं उनके साथ स्ट्रगल कर रही हूँ इस एट दिस पॉइंट. मेरे साथ की जिन लड़कियों ने बेबीज पहले किए, उनके बच्चे अब मेडिकल कॉलेज जाने लगे हैं, मगर उन्होंने अपने कैरियर्स की तरफ वापस आई हैं, और उन्होंने अपने कैरियर्स को पिक किया है. सो मेरा कहने का मकसद ये है कि जो ये सारी चीजें को मुकम्मल करने में ना, आप सब 10 साल तो कहीं नहीं गए. ये चीज करते करते लड़कों को 5 साल लगेंगे ना, अपनी ट्रेनिंग की, साथ में बच्चे भी कर लिए, फैमिली भी चला ली, उनको 5-6 साल लगेंगे. लड़कियों को 10 साल एटलीस्ट लग जाएंगे. इससे कोई फर्क नहीं पड़ता कि पहले शादी की और बच्चे किए और फिर कैरियर किया, या पहले कैरियर किया और बाद में बच्चे किए. इससे फर्क नहीं पड़ता है. जो लड़कियां परेशान होती हैं शादी करके कि मेरे करियर का नहीं बनेगा, तो दूसरी तरफ जो करियर कर रही होती है वो परेशान होती है कि बच्चे कैसे होंगे और कब होंगे. सो ये चीज तो आपके साथ लगी रहेगी. बस आपने ये करना है कि अगर आप जो भी करें, अपने करियर को, अपने प्रोफेशन को छोड़ना नहीं है कि बस यार बहुत अरसा हो गया मैंने किया नहीं, मुझसे होता नहीं. नहीं, ये नहीं करना है. स्टार्ट इट फ्रॉम समवेयर, इफ यू हैव लेफ्ट इट, स्टार्ट इट. आज अभी सोचें, फैसला करें, मैंने अपने करियर को दोबारा से शुरू करना है। छोटे लेवल से शुरू करें, कहीं से शुरू करें, पढ़ना शुरू करें, कोई एग्जाम देना शुरू करें। अगर आप साथ साथ एग्जाम देती हैं, साथ साथ सब कुछ करती हैं, वो भी बहुत अच्छा है। बहुत मुश्किल होता है, इट इज डिफिकल्ट फॉर एवरीवन, बट आपको ये दोनों चीजें आप कर सकते हैं, क्योंकि हम करते हैं और ये हो जाता है सब कुछ। सो ये जो एक एंजाइटी है ना, लड़कियों में खास तौर पे रहती है कि शादी कब होगी, जिनकी शादी होगी है मेरे करियर का क्या बनेगा। सो इस एंजाइटी को नहीं लो और चीजों को करने की कोशिश करो, तो दोनों चीजें हो जाएंगी। इट विल टेक टाइम बट इट विल हैपन। सो इस चीज को लेके परेशान नहीं होना, ठीक है। दैट इज माई मेन मैसेज टू ऑल द गर्ल्स आउट देयर। करियर नहीं छोड़ना है, शादी भी करनी है, दैट इज ऑल्सो इम्पोर्टेंट, दैट इज पार्ट ऑफ लाइफ, मगर करियर भी नहीं छोड़ना है। दोनों चीजें लेके चलनी है। आपको टाइम लगता है, जितना लगता है लग जाए, इससे कोई फर्क नहीं पड़ता है। कोई आपकी एज नहीं पूछता है आके कि आप कितने बड़े हो गए हैं, कितने वो हैं, कोई इससे फर्क नहीं पड़ता। मगर आपने दोनों चीजें कर सकते हैं आप, और करनी चाहिए।
That's a really good message. Dr. Urooj, since we are done with the main questions, can we move towards the rapid fire round?
Okay, there's a rapid fire.
Uh,
All
there's
right.
there's 5 to 6 questions.
Okay.
You can answer in as short as possible.
Okay.
Tell me when you're ready. Now,
All right. Okay. Yes.
so my first question is, if you weren't a doctor, what do you think you would be?
I would be lawyer.
A lawyer.
I
What
talk
do
to
you like? What do you like to do in your free time outside of medicine?
I used to read books, and now I watch movies whenever I can.
What's one thing you believe is not appreciated about you specifically?
Sorry, what one thing I did
What's
not?
one thing do not believe is appreciated about you or is underappreciated?
About me?
Yeah.
Mm, me being nice. I think.
What's the most complex case that you have ever come across?
Complex thing in a way, what? In a medical field?
Complex case, a medical case.
A complex disease in a medical field. So the most complex disease I come around is the transgender. I'm sorry, I have to talk about these things. That's what I come across. Transgender. It just, it becomes so difficult. It's really difficult to tackle these patients, to understand what they are going through, to make them understand what will be good for them. And it's really difficult these are the most difficult situations I think I face is this one. Yeah.
What's your favorite research topic or your area of research?
So I like pituitary. I really like doing researches on pituitary glands. Recently, I'm also obesity, the newer drugs which have come up with obesity. So that's quite intriguing. We have many available in Pakistan now. So to see how they are effective. So that part is also very interesting. It's mainly that, yeah.
What's one thing you wish patients knew about their endocrine health?
That being healthy, living a healthy life, not being sedentary, doing exercise, eating good and healthy food, and avoiding fast foods and junk and the fizzy drinks and stuff like that can treat most of the chronic disorders like diabetes and hypertension, and the endocrine disorders like PCOS and obesity. So if they just knew that, and they could fix their ways of living.
I really loved our session today, Dr. Urooj.
Thank you so
This was a very insightful conversation. It was such an honor to have you. Thank you again.
so much, Afreen. It was good to be here, and I'm honored to be here. I'm happy to see young people having all these new ideas and doing. I'm really amazed with the newer generation of which I see in my medical colleges nowadays. The awareness about the research, the awareness about other areas of medicine is really amazing. So yeah, you guys are really amazing.
Thank you for watching, everyone. Our guest today was Dr. Urooj Lal Rehman, an Associate Professor of Endocrinology at JPMC. See you in the next episode.